Hey everyone, welcome back to the Neurologic Wellness Podcast. Today I'm here with Dr. Ali White of the Tick Chicks. Thank you for joining me.
Thank you for having me. I'm very excited to be here. Very familiar with integrative wellness and everything they do there. So it just seems like a natural fit.
Mm-hmm. Of course. Yeah, I think what we do is very complementary of each other. And you have a podcast specifically on the topic that we're going to touch on today, and that is the Tick Chicks. So we wanted to talk today about Lyme disease, which is, I think, on a lot of people's minds now. But can you first tell us a little bit about yourself and your journey in healthcare?
Sure, absolutely. I was an active type A, outgoing personality before all of this. My world kind of came crashing down. One day, I woke up and I couldn't really walk correctly, and I thought I had broken a bone in my foot. Went to the ER, had it x-rayed, nothing. Went to several specialists, and they finally decided it was basically nerve damage. And at that point, I started realizing there was something systemically going wrong in my body, and that pain kind of then transferred over to my other foot. Then it started lodging in different parts of my body, and I realized I had big issues. So I really went from specialist to specialist. I wasn't getting any answers. Finally, a neurologic expert. I went to two neurologists basically here in Los Angeles, and one basically said I had a pain disorder. The other one said it might be fibromyalgia. Here's some gabapentin. And I managed it a little bit with the gabapentin in the beginning, but that was very scary for me because it's an anti-seizure and I wasn't having seizures. So I didn't know really why I was on that medication. Ended up getting sort of some lumpy lymph node type things on my body. And so my doctor referred me to a cancer specialist who did a huge scan and said, it's not your lymph nodes. I don't know what's going on with you, but have you ever considered having a Lyme disease test? And I had heard about Lyme disease, and every time I researched it or looked into it on the internet, it seemed like no testing was really thorough. It wasn't worth all the money that you would spend on testing because it tends to be very expensive. And it really just always made me walk away being confused. Like, is it a real thing? Is it actually traceable in somebody's blood? That kind of thing. But I went to get tested. I came back positive from one doctor, went to another doctor, started off from ground zero. He did his own battery of testing, and I came up with the second conclusive Lyme disease test. And it made sense because I had had a couple of summers in Maine, in that area. That's all I can really think back in my mind because I never had a bullseye rash, which many people don't. They don't even see a tick on them. Now we're beginning to investigate, doctors are beginning to investigate and research whether or not it can be passed along from mother to fetus. And that would explain a lot for a lot of people if that actually comes back to be positive. And there's a lot of research that's heading in that direction. So anyway, long story short, I got the diagnosis. I was relieved on one hand and also confused at how to actually treat it. There is no cure for Lyme disease, and there aren't a lot of doctors that completely embrace it or understand it or want to understand it. So that is why I started a company called the Tick Chicks. It's kind of a happy place for people who are suffering from debilitating chronic illness, and specifically Lyme disease. And basically it's one place where you can come to get a lot further ahead and get a lot of information and kind of be able to empower yourself to make your own decisions, and where you should, where it feels like you should go, in what direction. So that's the basis of my website, because I never had that. And it still, even though I got the diagnosis, I would say it took me another 6 years to consider myself fully healed.
Mhm.
So it's a very long journey. I mean, probably 12 plus years for me. And
Yeah.
that's actually in probably the average category.
Mhm. And that's a great resource that you provide to the world, in that. You mentioned something that I thought was interesting, and that before you ever got tested, you did some Googling. The test said, it's not really worth it. You're going to waste all your money, things like that. I think that is a very real concern with a lot of patients,
Yeah.
who are considering exploring if they have Lyme or not. Can you touch on the validity, or maybe where that comes from, and maybe dispel some of those things?
Sure. Yeah. So basically, when you get bit by a tick, this is what we know for fact. Okay. We know that it can come from ticks, mosquitoes, spiders, any vector borne, but primarily ticks would be our biggest carrier of Lyme disease. So when you get bit by a tick, there are certain people that have excellent terrain already in their body. They have excellent defenses, they have a robust immune system, and they barely feel any sort of side effects. They might take a round of antibiotics, a short course, and be done with it. Then there are those who have had major happenings in their lifestyle up until that point that sort of knocked down their immune system. You talk a lot about concussion. That's certainly one of the many things that could be underlying. Things like a big virus like EBV or mono that lingers around. It's not bothering you every day, but it has broken down your immune system. For me, I also had shingles on top of that as a teenager. You're going along in your life, you get the tick bite, and maybe you're at a certain stress level, or your immune system isn't robust, and it basically trips up an entire breakdown of your nervous system. And that's where I love your institute, because it really addresses so many different areas. For some people, it's only neurological and they have trouble with their gross motor skills. For other people, it's a gut breakdown and they become celiac or extremely sensitive to certain foods. For others, it's just a matter of, brain fog, severe fatigue, all sorts of things. So when you go to get tested, not only are you trying to get a test done during a certain life cycle of the bacteria that is quote unquote Lyme disease or certain tick-borne diseases or other co-infections. So they tend to, and don't quote me on this, but I believe they tend to do like a 3-week cycle. So they're living, they're dying, they're reproducing, they're digging in, they're burrowing, they're hiding. The Lyme disease bacteria is very evasive. So you kind of have to catch it at the right time. And then on top of that, what most neurologists will recommend is the Lisa test, which is outdated. They'll also recommend some other basic tests that were developed in the 70s, Western blot. You can't just take one test and come to a conclusion. You have to really test. If you're going to go like that, you're going to have to use different separate tests because, as you know, there's over 100 bacteria that can cause damage from ticks and vectors, some of which are much worse than Lyme disease itself. And you can become immediately hospitalized if you're not careful. So you're really battling a lot of moving parts when you're talking about testing. One particular lab that I like is called IGeneX Labs. They're in San Francisco, and the entire lab is devoted to tick-borne disease.
Mhm.
They really don't test for anything else. You can even take a tick off your dog or yourself, put in a Ziploc and send it to IGeneX. They'll tell you exactly what bacteria that tick was carrying at the time that it bit. So it's a very helpful lab, but the problem is that insurance doesn't cover it, and it's also a very it's also very expensive. Now I like IGeneX because they have certain tests that they could do for a few $100s, and then they can do a full-blown panel for the 20, let's call it $2,300 if you really want to get specific. If you've had lingering issues for 10 years and nobody's gotten to the bottom of it, you may want to really invest in something like that.
Mhm. Okay. And how likely is it, I guess, for people to need like multiple tests to actually pick up on things? Because is it fairly hard to actually to diagnose in a lot of cases?
Well, you get a lot of false negatives.
Hmm.
And no, I mean, I would really tell the average person, if you can call IGeneX and have them explain to you exactly what types of tests they offer and at what different price points, if you can go the distance and do the full blown package, I would always recommend that. If you can only do maybe half of the test this year and maybe the other half of the test next year, do that. But what they'll do is they'll send the test to your doctor, and then they will tell the doctor and direct the doctor on how to read the results. So you don't have to travel to San Francisco or anything, but it really should be read by a physician at
Sure.
the direction of IGeneX, because it's also difficult to interpret a lot of those. But
Sure.
at thetickchicks.com, it's a great resource. It's a great sort of like center for Lyme disease. I talk, I sort of go on my homepage, I talk about what is Lyme disease exactly,
Hmm.
what to do if you've been recently diagnosed, like your very first steps. And I talk about my healing triangle, which is to always integrate conventional medicine, integrative medicine, and holistic medicine at the same time if you can. Because again, there's no cure. So you might as well try to do all things equally, sort of. A lot of people start off at conventional medicine, take a round or two or a year of antibiotics, and then will eventually sort of work their way over into the integrative medicine um, category. And then there's also the emotional part of it, which, because it takes a very big toll on your family, on your own mental health. And we talk a lot about that, especially for caregivers.
Hmm.
And I have a podcast called Lyme Time, which is also on YouTube, Spotify, and Apple. And it's great because you get free advice from all of the experts in the field. Maybe you can't travel to Europe or New York, something like that, because of all those all the financial reasons, I suppose, or time or energy, whatever it is. Maybe you can't actually fly right now because you're bedridden. I have a lot of free advice from all the experts on the podcasts, and they offer each episode is just packed full of great things. I try to ask the questions that I think my listeners want to ask the doctors, and so that's a great podcast. I also offer classes because oftentimes, you have Lyme disease, but you're not really sure which direction you want to go. For some people, they don't even want to go with antibiotics. It's just a very small percentage of people that are actually cured by an antibiotic round. So there's lots of questions that open up with regard to treatments in terms of integrative medicine and functional medicine. So I call it a boot camp. And basically we partner up for 6 months, and we're in a small group, and we talk a lot about where to what your roadblocks are, what's coming up for you. And then I can direct them to the best experts in those fields. And it's really good to connect with other people in that area. So, and then once a year I hold a retreat, and that's an in-person retreat with the experts in every field that most of my listeners want to hear about. And not only do you get great information for the price of one sitting, one chair, for the whole weekend, you get to hear from all of these amazing experts. Many of them have written books and published in the fields of neurology or Lyme disease and that kind of thing. And then we have a big Q&A session. You can ask your own personal questions that come up, or somebody else sitting next to you might ask a great question. And so it's just a really good feel-good event.
Yeah.
And I know that a lot of Lyme disease patients are isolated. So we spend a lot of time just sort of connecting with one another, and it's an amazing weekend. So that's a great retreat. That's called Losing Lyme. It happens every October. And yeah.
That's fantastic. All of these great resources that are now available for all the patients who are suffering with Lyme or potentially suffering with Lyme. It is great that these resources are available, and that they are growing kind of with the number of people who are getting Lyme, which I think brings me to my next question. I think this is a question that a lot of people that I talk to about Lyme have, or patients have, but it seems like Lyme seems to be increasing more and more. We hear about it more and more and more. Like it's an older disease in its like essential form. It's pretty familiar with Lyme in the medical literature, but it seems to be maybe different now than maybe it was originally. It seems to be, I don't know. I don't want to say changing, but like there are different things that people are picking up on, or it seems like more and more people are being diagnosed with Lyme. What do you think that is? Is it a matter of people we just have better testing now? People are becoming more aware of it, or is there actually something in the environment that is changing that's making this more?
Well, if you ask a conspiracy theorist, they will tell you that it was engineered, that the actual bacteria was taken and engineered during World War II. And there have been books written about it on hidden and classified documents. I mean, do with that what you will, but I will say that it's most prevalent in the countries that were involved in World War II. But yeah, the bacteria has been around forever, since the Ice Age. And but during the 70s, that's when it became on our radar in the United States. Basically, there was an outbreak in Lyme, Connecticut, actually, and doctors did not know what was going on over there. There was just a lot of people going down, a lot of children, because they were playing in the woods and all of that. So there's a great podcast. I have it on my website. It's called Patient Zero, I believe. And it's a great history. It's an 8-hour long, there are 8 episodes, and I was fascinated by it. But to our basic understanding, Lyme disease has become rapidly prevalent, and it's now being classified as an endemic situation in our country. And we don't know if that's just because some people say it's climate change. I don't know that that's necessarily true. What I do know is that cities like Atlanta, for instance, it is growing so fast that our cities are now expanding into the suburbs, into these areas where there was organic wildlife there. And you might see deer in your backyard where you wouldn't have normally seen them. So I think there's a big degree of just our cities expanding, more people living in the suburbs, and not really realizing that when they go to sleep at night, there's all kinds of wildlife coming through their yards. It could be wild turkey, it could be raccoons, it could be deer. They come closer to structures just to get a little protection during the winter, and then they disappear during the day. And all of that is going into our yards and our bushes and all of that. And our kids are still playing outside, and it's a beautiful spring day, or the leaves are falling. We're just not really aware. The average a deer can carry up to 1,000 ticks. So they jump off in all kinds of a grass and long grass and plants and leaves. So I can't really tell you why. A big question mark for me is the bacteria able to pass that barrier between mother and child? And we just don't have the research on that right now. But I just came across a lab the other day, and actually I might start working with them a little bit. They seem to sort of offer something that I hadn't seen in a while, and it's called True Health Labs. And I'm going to do my own further investigation, but they actually offer a test for newborn babies.
Oh, wow.
And a lot of my listeners are women who want to become pregnant or are pregnant and get the diagnosis and are terrified that they're going to pass this along to their child. They want to know, should I go on an herbal protocol while I'm pregnant? Or is there any way to prevent this from passing along to my baby? I don't have the answers for them, but I thought it was interesting that this lab actually now has a test for newborn babies. So if that becomes a thing, and we're all donating blood, and if that's a potential situation where it could be passed along, that would explain a lot of it. The CDC 3 years ago went from the average United States case rate from 30,000 to 455,000. I mean, you don't take that big of a jump without recognizing something's going on here. And it only increases every year.
Right. So say a patient, you mentioned not a lot of patients want to go the antibiotic route or see benefit with antibiotics, I think you said. What are the treatment options available? What are people doing to actually combat Lyme?
Okay, so if you're nervous about antibiotics, number one, there's not a 100% guarantee it's even going to affect the bacteria, but that's where doctors like to start. Patients don't like it because it causes something called a Herxheimer reaction, which is when things are dying off, it affects Lyme patients very negatively. So taking a simple antibiotic creates a cytokine storm in their system, and it's really painful. So if you want to go in a different direction, I mean, for me, I always love herbal protocols. And on my website, I actually have all kinds of discounts for the two main protocols that I'm most familiar with. That's Dr. Cowden's protocol on NutraMedics. You buy a month at a time, and each month it changes slightly. And I think he recommends doing it for, I don't know, up to 6 months or something like that. There's also Vital Plan, which is our Vital Life, and it is on my website as well. And it's been developed by Dr. Bill Rawls, and I love that particular. It's called the Restore Kit. He can't call it legally the Lyme disease treatment kit, but it's on Vital Plan. I have discounts on my website as well, but it's 4 basic herbal pills that you take at certain times during the day. So I do like those. But also on my page, I also talk about all sorts of different things. And it's up to each patient to figure out what they like the best. I talk about, infrared sauna, hydrotherapy, cupping, dry brushing, Epsom salt baths, essential oils, those kinds of things. There's light therapy. There's also ozone therapy, a 10-pass ozone therapy, which many people have had success with. All sorts of um, neurological treatments,
Hmm.
which I think are very important to Lyme disease patients because they actually experience so much brain fog that
Hmm.
that can be really key to unlocking their basic survival during the day.
Hmm.
Chiropractor, biological dentist can sometimes go into a cavitation in the mouth or previous surgery or tooth removal and find a pocket of hidden and thriving bacteria that we're not always able to see with the naked eye, and they can clean that up and get that out. And a lot of people experience, that first layer of hopefulness after something like that. Cryotherapy, hyperthermia, IV drips, peptides, stem cell. There's just a lot of options. And I
Hmm.
would just say that's where my boot camp kind of comes in handy because, again, you're not really sure where to turn. And I always say just start with baby steps. I remember my first step once I had done the antibiotics, I just was in so much pain and discomfort. I thought I'm going to start with a chiropractor
Hmm.
and just he couldn't even touch my body for like the first 3 times because I was so inflamed.
Hmm.
And we just took it baby steps by baby steps, and that was really key for me. I would always recommend people going to a center like yours where it's kind of one-stop shopping, where you get an initial intake for a few hours and they really do an overview. And there are, the Klinghardt Center, which is the Sophia Center up in uh, near Seattle. There's actually one in Mexico that people have had good luck with. There's something called Lyme Stop in the United States. You have to travel to those places and really dedicate time. But like I said, it's good for one-stop shopping.
Hmm.
And I will just add a footnote that when you're in an acute state of Lyme disease and you're really, really in bed, there isn't much that you can do until your body settles down.
Hmm.
And so your body is in fight or flight, your nerve endings are going crazy. Um, it's very painful. And that is a very hard place to be. But a lot of these treatments that I just mentioned are
Hmm.
most effective when after your system settles down. And then you can take baby steps into the next, what I call phase 2 or phase 3 stage of Lyme disease.
Hmm.
You
And
just
yet,
can't try all this stuff at once and expect your body, who's barely surviving,
hmm.
to be able to take on anything else. Even something like infrared sauna, it's so wonderful. We all love it, but it can cause you to go 10 steps backwards in that acute state.
Yeah. And you had mentioned how there's no one cure for Lyme disease. Or there is no cure for Lyme disease. It's something you may have to um, manage for the foreseeable future.
Sure.
Could
Yeah, and
you?
I talk a lot about just being patient
Hmm.
and and visualizing a positive outcome.
Hmm.
If you get stuck in the cycle of, and it's very easy to do when nobody's providing you answers or when they're just saying be patient, but mind over matter is huge with chronic illness.
Hmm. And obviously, at your website, you provide so many options and such a good roadmap for people who are in that position. but could you kind of illuminate people on what what's a typical roller coaster ride on the ride of Lyme, right? Like how is that going to be for somebody as they go through treatment? And what can they expect?
Uh, you're going to just have in the very beginning, when you have an acute state, it's the emotional roller coaster is just giving yourself permission to rest, giving yourself permission to say no to social obligations, to family obligations, even within your own home. You'll need help from people around you, and you'll need understanding on some level, even though they cannot relate. But that's challenging for a lot of people. For those people who live in isolation from Lyme disease, I also have a private peer-to-peer support group. You can get that at thetickchicks.com, and there's a link there. It's on Facebook, actually. And there, I think we have about 700 members. And if you have a question like, oh, I'm taking a vacation in Florida, and I'm going to need some support while I'm there or some treatments. I'll be in this area. Does anybody have a great recommendation? Or, has anybody had a side effect from this medication or something like that? It's a really great place where people can find that support.
Mm-hmm.
And I would just say connect with other people. As you go to stage 2 and stage 3, I think there are 3 stages of Lyme disease. And as you go through those and you're becoming able to go and have a social obligation or actually make an appearance and put clothes on and brush your hair and look nice and actually be able to start to do that, you're often misunderstood because you look normal. And that's the joke of Lyme disease. It's like, yeah, but you look great. And you're sitting there barely able to stand. And so, again, reaching out, being connected, going and taking some breath work classes, some brain retraining classes. And I'm not even just talking about neurological connectivity and treatments. I'm talking about actual brain retraining where you're teaching your brain and you're rethinking thoughts and you're actually making a new thought process that says, I am well. Because your brain stays stuck in fight or flight, and your brain can keep putting up protection barriers and saying, oh, I don't want to try this. I don't want to do that because, oh my gosh, what if I set off another set of episodes? Right. So that's a psychological thing that we have to develop and kind of get through and give yourself permission to be a normal person. Even if you don't feel like it, go ahead and keep trying and acting as if. Sometimes that's the best thing. But also at the website, I have great cookbooks because diet is such an important part of healing chronic illness. And I often think that people think they have to eat like a bird, and they don't. There are delicious recipes that are wholesome and good for you and provide very little inflammation. So I put all those on the website as well. So it's really just mastering a new way of life for yourself and still having hope that you will be back to normal. And I'm living proof that you can be.
Excellent. And now you can give back to the community. We only have a couple minutes left, but I know you just talked about the diet plan and the recipes and things like that, and you've mentioned your website. But can you remind people again where they can find more about you, your website, your podcast, all the things you're involved with?
Sure, I'd love to. I'm active on Instagram daily. And if you have a quick question for me, it's at the Tick Chicks. And then, of course, thetickchicks.com is my wheelhouse. That's where you can find everything about me. And then the Facebook page, which is called the Tick Chicks Private Support Group for Lyme Disease and Chronic Illness. I have the podcast Lyme Time, which is on YouTube, Spotify, Apple. And I'm also, every time I make a post on Instagram, it goes out to Pinterest, Twitter, all those good places. And occasionally I'm on TikTok, although, it's a love-hate relationship, but
Hmm.
I find that there's a huge audience over there that I'm
Hmm.
tapping into, and I don't do any dancing and singing, so don't worry about that. But I do connect with a lot of people who are still trying to figure out their mystery illness.
That's great. So many options, so many media. So that's great. So if you're listening to this and you or someone you love may be dealing with Lyme disease, go check those resources out, get some guidance, get some direction. And yeah, thank you again for coming on today, Allie. This has been great. It's been so informative. I really appreciate you.
Thank you for having me. I hope to talk to you soon and to work with you as well.
Of course. And this has been your host from the Neuro Wellness Podcast. Be well.